Welcome back. So in this lesson, we're going to learn about why behaviors happen, or what is the function of the behavior. Usually when the families we work with come to EAP, the first question they usually ask is, how do I stop my child's behavior? And usually the first question we ask in response is, why is your child doing this challenging behavior? A good practice is to remember that all behavior is a form of communication. So when your child is engaging in challenging behaviors, ask yourself this: what is he or she trying to communicate? What is he or she trying to tell me? Before we get into the common reasons for behaviors, the first thing you need to do is to rule out any external or physiological reasons. This means that if your child is crying or whining or biting, check that they're not doing this because of any physiological or medical reason, as though they're feeling pain anywhere. If you aren't sure if it's a medical reason, it's really good idea to have your child checked by a doctor just to be safe. Okay, so once you're sure that there is no physiological or medical reason, then we can look at the four most common reasons or functions of behaviors. These are tangible reinforcement. This is essentially a thing your child wants, whether that's toys, phone, food. Automatic reinforcement. This is something the child does to stimulate themselves, like jumping or spinning around, commonly known as stimming behavior. Thirdly, social reinforcement. This is attention given by someone else. Or escape behavior, trying to avoid a task or an item, such as work or dinner time or even medication. To make it even simpler, think of these four functions as two general categories. Either your child is trying to get something, tangible, automatic, or social, or get away from something, like to escape. Now let's take a look at some examples.
Is the child trying to get something or get away from something? Get something, that's absolutely right. Now, what do you think he was trying to get? Tangible, automatic, or social reinforcement? Tangible reinforcement, very good. How about this example? Is the child trying to get something or get away from something? Get something, that's absolutely right. But what is he trying to get? Again, tangible, automatic, or social reinforcement? You're right. The toe walking is automatic in that the child does the toe walking themselves, which automatically reinforces the behavior. How about this one?
Hey, what are you doing? Clean it up now. I said to clean it up.
What is the child trying to do? Get something or get away from something? That is correct. But what is he trying to get? That's right. He wanted his mother's attention and got it by deliberately throwing the chair. Finally, how about this one?
Right two. Right, hold your pencil. Right two.
What's the child trying to do? Great. Notice how he's not trying to get something, but rather try to get away from something. In this case, doing work at the table.
Now it's your turn. Remember those top 3 behaviors you chose from your list earlier? In the functions column, try to identify, for each behavior, is your child trying to get something or get away from something? Secondly, which of the 4 functions of behaviors are the reasons for those behaviors? In other words, are they trying to gain tangible reinforcement, get automatic reinforcement, get social attention, or to get away from a task? So remember, always ask yourself first, why is this behavior happening? What is my child trying to tell me? What is the function of this behavior? In our next few lessons, we're going to be looking at multiple strategies to address these behaviors before they happen and even after. So stay tuned.